Hi, Mary. Thanks for coming back
Hi.
in. Good to see you again.
Thank you.
Well, tell me how things have gone since the last time I saw you.
I started on the medication. It seems like it's working. Like
Okay.
I'm not thinking about it as much.
Okay.
But I'm still thinking about it.
Okay. Okay. And you've been taking one pill a day.
Mm-hmm.
Okay. How has it gone with letting that pill dissolve under your tongue?
It tastes really bad,
I've heard that. Yeah. Yeah.
but I can do it.
Okay. Okay. You feel like you're giving it enough time to let that dissolve?
I read the package and it said to hold it in there for 10 minutes.
Yeah,
And so I've been
yeah.
trying to hold the saliva
Okay.
in there.
Okay. Yeah, and I know that's not easy.
Mhm.
So good. It sounds like you're taking it right. So what are you noticing? Are you still feeling like you're having any symptoms of withdrawal?
I feel like it helped me with my sickness, but
Okay.
like I still think about it
Okay.
a lot. I slept for the first time in a really long time. I still woke up
Good.
really early, but
Okay.
I can't remember the last time I slept like that.
Okay. Okay. Well, good. Good. So what I want to have you try is I want you to try taking 2 of those pills every day.
Okay.
And there's a couple of ways you can do that. What I want you to try at first is just go ahead and take both of those pills at once. Just take them right away in the morning.
Okay.
If that doesn't seem to work very well, if it's just hard to dissolve both of the pills, or if you feel like the medicine sort of wears off later in the day, then you can do it where you take one in the morning and one at night. But I don't want you to split it up any more than that, because I don't want this medicine to be a barrier to your day-to-day life. I want it to be something you don't really have to think about,
Right.
something you can just do every day without putting a lot of thought into it. Does that sound like a good plan?
Yes.
And really the goal with this medicine is getting you to a point where you don't feel like you're having any cravings, any thoughts. Now, that's not always possible. It may be that you still experience some cravings or occasional thoughts, but there's other ways that we can deal with that beyond the medication.
I'm already so much better. Like I was able to leave the house without going and getting any.
That's great. That's great. Have you had contact with anyone who sold to you or gave drugs to you?
I've been trying to avoid them.
Yeah, and that can be really hard. For some of my patients, they need to change their phone number or really take a lot of extra steps to make sure that those people can't contact them.
Right.
So that's something to think about. Because really the more barriers you can put between yourself and drugs, the better you're going to do. Any side effects from the medicine?
I think it might have made me a little more sick to my stomach when I first took it.
Okay. Okay, that can happen.
But I don't think I had any
Okay.
problems with
So
it.
some people do notice a little nausea. That will probably get better as time goes on. Have you had any problems with constipation?
No.
Okay. So I always like to warn my patients that that's something you may notice as time goes on, especially if you start taking a higher dose.
Okay.
This medicine can definitely cause some constipation. The best thing you can do for that, it's an over-the-counter medicine called Miralax. It's a powder, and what you do is you take a scoopful of powder and mix it in a glass of water. And some of my patients just do that every day just to keep from getting constipated. And that's safe to do long term.
Okay.
Okay, good, good. Was the medication affordable? Was that something that your mom is going to be able to keep paying for?
I think that it was like $8 or $10 a tablet.
Okay, okay.
But it was only 3 or 4 tablets, so
Okay.
I think that it was okay.
So one thing I want to do today is get started enrolling you in a patient assistance program. So the company that makes Suboxone, they actually have a program that they offer for patients in your situation. where you can get the medicine for free for a year.
Okay,
And I think that'd be a great asset
that
for
would be
you.
amazing.
So I'll get started on the paperwork for that, and there's some documents I'll need from you, so I'll have my nurse contact you.
Okay.
One other thing I wanted to talk to you about today, do you feel like other kinds of treatment would be helpful? So for some people, meeting with a counselor or going to meetings can be beneficial.
I think it's worth trying. I don't know what that would be like for me.
Sure, and it's a little different for everyone. You know, I have some patients who really feel like they get a lot out of the meetings, just hearing other people's stories and getting support from people who have been through what they've been through. I have other patients who really don't feel like they benefited from it. But yeah, I want to make sure that those options are available if you want them. So I printed out, this is a schedule of Narcotics Anonymous meetings here in Columbia. So there's a lot of meetings available, and meetings all over town at different times, on different days. So I'll give this to you. So you can take that and look that over and see if there's times that are going to fit into your schedule.
Something close to the house, maybe.
Mm-hmm. Yeah.
I needed something to do anyway. I didn't even know what to do with myself. I've been so busy.
Yeah,
I've been
once
so
once you
busy.
have that burden taken off you,
Yeah.
it really frees up some time.
It's kind of like, now what?
Right.
Right.
Absolutely.
So I do have time.
I've also got a list of some counseling resources. So some of these are inpatient programs, others are just outpatient programs where you meet with a counselor.
Okay.
And a lot of these programs they have a sliding fee schedule, so for people who don't have insurance or have lower income, they try to make it affordable for you. So I'll give you that today too.
Thank you.
So just other things to be thinking about. One thing that I didn't talk to you about last time is that aside from treating addiction, I'm also just a general family medicine doctor.
Mm-hmm.
So I'm happy to be your primary doctor. If there's issues outside of drug use that you want to talk about,
Yeah.
then I'm more than happy to talk to you about that.
Yeah.
So don't feel like these visits just have to be about opioid addiction.
Right. I've been wanting to get back on birth control.
Yeah, so let's talk about that.
Okay.
What kind of birth control have you used before?
I was on the pill
Okay.
before, and I just wasn't able to afford it.
Okay,
It seemed fine.
yeah, so no side effects with that, it worked well for you?
I used it for years, and
Okay.
it helped control my periods, and
Okay,
yeah.
so I think it would be fine to go ahead and get you back on that, and I'm happy to prescribe that today.
Okay.
That's a good thing to be thinking about. You know, if at some point in the future, if you want to talk about other kinds of birth control, there are other things that are sometimes a little more effective than the pill. There's a Depo-Provera shot, there's implantable rods that go under the skin, there's IUDs, and those can stay in much longer. But for right now, I think just starting the pill is fine.
Great.
And you're taking something every day anyway, so it should be easy to remember to get that pill.
Yeah, I never had a problem with that.
Okay, good. Well, I'll send that to our pharmacy here, and you can go ahead and get that going again.
Good.
We talked last time about doing some other health screenings, looking at hepatitis C, HIV. I'm not going to do that today just because of the expense of those tests. You may want to see if the health department offers any of those screenings.
Oh,
That may be an option for you.
okay.
But I think just with that history of injection drug use, it is important to do.
Oh, yeah.
Because certainly, you know, we have good treatments for hepatitis C now. It's curable for most people, and HIV is at least treatable and controllable.
Yeah, I think it would be better to know either way.
Yeah, absolutely. Thank you for giving a urine sample today. So I looked at that result before I came in today. It was still positive for OxyContin, but that's okay. That drug takes a little while to get out of your system.
Yeah, I didn't use any.
Okay, yeah, and I believe you about that. It did show buprenorphine, so that's good. It means that you're taking it. So we'll plan on checking that again the next time I see you.
Right.
Any questions about anything that we've talked about today?
I don't think so.
Okay, okay.
When do I need to come back?
So I want to see you again in 1 week. And in a week, we'll make sure that things are going okay. We'll talk about how the new dose of the medicine works.
Okay.
And if the dose is working okay and everything else is going okay, then we can talk about spacing out those visits even a little bit more.
Great.
Okay.
Yeah, that'll be good.
Any other concerns today?
Not right now.
Okay, well, I'll send in the prescription for your birth control pill and a new prescription for your buprenorphine, and I'll see you again next week.
Okay, great.
Okay. Good to
Thank
see
you so
again, Mary.
much.
Yeah, thanks for coming in.